NMAP.
We heal with zeal.
Together, we navigate
New frontiers.
Hello everyone, I'm Dr. Sushmita. I'm a practicing pediatrician in Kopar, Khairani and Vashi. Today on this platform of Navi Mumbai's Association of Pediatrics, I will be speaking to you about diabetes. November is the Diabetes Awareness Month, and though 14th of November is Children's Day in India, world over it is considered as World Diabetes Day. Though most of you are aware about diabetes, but what you may be unaware of and what is very alarming is that diabetes type 2, which was once upon a time a disease of the elderly, is affecting more and more young adults and teenage children today. And why is this happening? It is because of our changing lifestyles. Fast foods and eating outside is so fashionable amongst our kids, and eating a healthy home-cooked meal is so uncool. Playing virtual games online for hours and spending time on laptops, mobiles and iPads is so attractive, and it leaves very little time for our children to go outdoors and play. And now with the pandemic and schools and colleges closed, activity is almost zero, and this has led to an increase in cases of obesity. And as obesity increases amongst our children, so does the risk of metabolic diseases, and type 2 diabetes is one of them. So what is diabetes? Diabetes is a chronic or lifelong disease which is characterized by high blood sugar. It cannot be cured, but it can be managed. There has been a lot of research going on for its cure in terms of stem cell and islet cells, but there has been no major breakthrough in this yet. Worldwide, there are a large number of people affected by diabetes, almost 483 million. Coming to some simple terminologies. What is glucose? Glucose is the simplest or most basic form of sugar which is derived from carbohydrates. It is the energy source for all cell functions. What is insulin? Insulin is the hormone which is produced by the beta cells of the pancreas, and its function is to regulate blood sugar. How does the blood sugar get regulated? How does this happen? So the food that we eat has got proteins, carbohydrates and fats. You all know about that. Carbohydrates are broken down into the simplest form, which is glucose. The glucose enters into the blood, and this stimulates the pancreas, and the signal is sent to release insulin. Insulin now works on the glucose to push it inside the cells, where it is utilized for energy. Whatever glucose remains goes to the liver, and it is stored there as glycogen to be released as glucose whenever our body needs it later. This way, the sugar now falls, insulin release stops till the next meal is taken. But now let us see what happens when things go haywire. As in, what happens if we eat too much or we eat too frequently and we have very little physical activity to utilize this glucose. So blood glucose levels remain very high. The pancreas work hard to release insulin, but the cells no longer need to take glucose inside. They become resistant to the insulin which is being released. So this is the stage of insulin resistance. Now there is more work for the liver to convert the glucose into glycogen. And after that, even the liver stops doing it, and then the glucose is stored in as fat cells, and this is when the person becomes overweight and obese. The stage is now set for prediabetes. Now what is prediabetes? Prediabetes is something which is before you become a diabetic, but you are not normal. And this is a very sinister and serious condition. Why? Because the incidence is as high as 1 in 7 every Indian gets it, but 88% of us are not even aware that we have a condition like prediabetes. Why? Because we do not have symptoms. If we go unchecked, we will go downhill and develop type 2 diabetes, heart diseases, stroke, gestational diabetes, polycystic ovarian disease, etc. Now coming to the types of diabetes. Type 1 diabetes is also known as juvenile diabetes. This is the diabetes which affects children. It is an autoimmune condition what that means is that all of you know that the immune system fights against the infections which come from outside. But autoimmune is when the immune system fights against your own cells. So in diabetes, the immune system of the body destroys the islet cells of the pancreas and insulin cannot be produced. In such patients, insulin is required throughout life. Only about 5% of all diabetics are diabetes type 1. 90%, however, are diabetes type 2. And this is the adult onset diabetes, which unfortunately is affecting children and adolescents today. Insulin resistance and prediabetes are the conditions which are precursors to diabetes type 2. The other forms are gestational diabetes, which is diabetes that occurs during pregnancy, monogenic diabetes, and secondary diabetes. Secondary diabetes occurs because of certain drugs like steroids and because of direct infections to the pancreas, which is known as pancreatitis. This slide shows the risk factor for diabetes, and they are pre-diabetes, overweight, which is measured by your BMI. Depending on your height, weight and age, your BMI is calculated. Age above 45 years. Today, younger adults and children also need to test themselves in case they have other risk factors. Family history of diabetes, meaning parents or siblings having diabetes. If you have a sedentary lifestyle with very little physical activity, which is the case today. Fat distribution around the waist. Metabolic syndromes like high blood sugar, high blood pressure, high cholesterol, high triglycerides, etc. Polycystic ovarian disease or PCOS, which is very common amongst the adolescent girls today. Acanthosis nigricans is when you have darkening of skin around your neck and in the axilla. You must consult your doctor. Here are the signs and symptoms of diabetes. Excessive urination, excessive thirst, excessive hunger, tiredness and fatigue, cuts and wounds that will not heal soon, sudden loss of weight, blurring of vision, repeated infections, tingling and numbness in toes and fingers. What diagnostic tests do we do for diabetes? You all know about fasting blood sugar, oral glucose tolerance test, and the HbA1c. So the pre-diabetic column is actually the one we need to be careful about. When we have values in this range, we have to take care so that we do not become diabetics. The list of complications is huge and scary. The heart and blood vessels get affected, causing heart attacks, hypertension, atherosclerosis, strokes. The nerves get affected, causing tingling and numbness, burning pain, loss of sensation, sexual dysfunctions, digestive problems, loss of bladder bowel control. The kidney may fail. Eyes may be affected, causing glaucoma, cataract, and blindness. Foot gets easily damaged because of loss of sensations, and sometimes they become gangrenous and may need to get amputated. Skins often have bacterial and fungal infections and ulcers and sores which will not heal. Hearing impairment, Alzheimer's disease, and depression are also other complications. This is a picture showing the complications. The treatment of diabetes includes diet management, lifestyle management, and medications. Medications in the form of oral anti-diabetic drugs and insulin. But isn't prevention always better? So can we prevent diabetes? How? We eat healthy and we eat right. We avoid eating processed food, packaged foods, red meat, trans fats, sugary drinks. We add more fiber to our diet, eat lots of fruits, vegetables and nuts. Eat only when you're hungry until you're not hungry anymore. This is a Japanese dictum, where you only eat when you're hungry. And just because you have all the food in front of you, don't have to finish it all. You don't have to be bursting, Stay physically fit. Go for a run, swim, bike. At least half an hour a day, 5 days a week is more than enough. But if you're overweight, you have to work more so that you lose weight. Check your blood sugars if at high risk, reduce stress, meditate, and improve your lifestyle. Quit smoking if you're a smoker. Now with this slide, I come to the end of my talk. Together we can stop diabetes. A healthy food for a wealthy mood. Don't sit, get fit. Start saying no to sugar. Say, I'm sweet enough. And life is short, so let's all go for a run. Eat a healthy meal to help your body heal and junk the junk food. Thank you. Stay healthy, stay safe, stay fit.